time now for a bit of health and my health watch, because a damning report into NHS dental services by the Health and Social Care Committee has called for urgent and fundamental reform, citing a YouGov poll showing almost a quarter of the UK population are not registered with a dentist. Now, this comes as some parts of Greater Manchester are reporting waiting lists of over 4,000 for an NHS dentist, as many warn the system cannot cope. So I'm joined now by Dr. RANA Al Falaki, or Falki, I think have I said that right? It's Dr. RANA Al Falaki.
Al Falaki, yes.
Al Falaki, lovely. Now, you're a multi-award-winning periodontal dental specialist. Wow, that sounds like a wonderful title, but what does it mean and what's happening to UK dentistry?
So my particular discipline of dentistry is related to gum disease, which is actually considered to be an indicator for early death. So that's actually how important dentists are nowadays. Working very much on, in my case, the gums and the structures that are around teeth. And actually, it saddens me so much because I used to be even an NHS consultant as a specialist and quit because I felt that I wasn't really able to help anybody. So the state of NHS dentistry is definitely at its limits, is the easiest way to say that.
So with this gum disease, there's a good sort of precursor to tell you whether you're going to die early or die soon, or whether you've got heart disease. What is it that you're actually looking for in the gums? Is it constant bleeding when you're cleaning your teeth? What kind of thing?
Yeah, I mean, funnily enough, actually, those who are most susceptible don't get those symptoms. So they don't necessarily have that issue, but the commonest things are bleeding gums. It may be bad breath. It may get to the point of loose teeth. It may be that their gums have receded. They start getting food stuck between their teeth. They have what we call black triangles. And interestingly, the weirdest thing is when there was a TV advert or an ad on the tube, we used to see a lot of the time saying, if your eyes were bleeding, would you not do something about it? And yet when people's gums bleed, it's almost become this norm that everybody accepts that is normal. And in fact, it's not in the slightest bit healthy.
Crikey. So with this whole situation, the NHS situation, what is it that is causing it? Is it too many people going to the dentist? Is it just bad management? What is at the root of it?
Yeah, it's certainly not too many people going to the dentist. If anything, we probably have fewer people who go to the dentist nowadays, which is a sad fact. It goes back a long way and is very much a combination of political and behavioural. Contracts changed the way that dentists were paid back from 2006. So I remember when I first started out my career as an NHS dentist, I was treating patients, and anything that I did on a patient, I was paid for. And children, we used to have what we called a capitation system. This is really quite relevant to the news that we heard this week as well, where so you would get paid to have a child on your books and be able to look after them, which also allowed you to provide more preventative care and be paid for it. Anyway, the contracts changed, and if anything, unfortunately, what we've seen with NHS dentistry in practice is it's gradually reduced itself to becoming more and more of a core service. So it gets to the point where actually the cost of providing the service, right down from the instruments and materials that you need to use on a patient, sometimes the fee that the dentist is then paid and the fee that the patient has to pay doesn't even cover the cost of the materials. So what we've got is this complete imbalance of expected standards of care, materials to use, and standards of care that dentists want to be able to provide versus the converse in that they're not being provided with enough money to be able to do that. And that is impacting massively. It's impacting massively on dentists who want to remain in the NHS. It's impacting on dentists' own health, which is where the other part of the work that I do is actually supporting dentists with the incredible high levels of stress that they have, and trying to see at least 30 patients a day with a huge, massive demand on them, not just in cost, but what's expected of them in terms of the service that they want to provide, the communication they want to convey to patients, obtaining the right amount of consent, giving patients all of the possible options, being able to to do what they feel is really good quality care.
But you can't get hold of one,
to
though.
write up those
But
notes.
this is,
Exactly.
Yeah, but you can't get hold of one, though. That's the problem. You can't get hold of one. They are not available. You can't get through. They haven't got any time or any room on their books.
Precisely.
If
So what
you've
has
got,
happened?
listen, we're running out of time.
they've-
So one piece of advice to people to help them look after their teeth better, apart from go to the dentist, because you can't get hold of one.
So you can't get hold of one because we've got more people leaving the profession due to those high levels of stress. So one piece of advice is brush your teeth effectively twice a day, have a low sugar diet, and watch out for those warning signs such as bleeding gums. And if you're in pain, don't ignore it.
All right, thank you very much, Dr. RANA AL FALAKI. Thank you so much. Lovely to talk to you. She's an award-winning periodontal dental specialist.